So we're here at Winunnga Aboriginal Health Service with the CEO, Julie Tongs, and we've been invited here after the Canadian and the Australian Roundtable on Indigenous health and wellbeing. Can you tell us a little bit about Winunnga?
Sure. Thanks, Summer. Yeah, I'm the CEO of Winunnga, and I've been the CEO of Winunnga for 19 years. But Winunnga's roots are pretty much in the tent embassy, because back in 1988, when the Queen visited Australia, the late Olive Brown, who was the founder of Winunnga, Dr. Sally Creasy, Carolyn Patterson, and the late Margaret McLeod actually set up a temporary clinic in Grevillea Park to look after the mob that come into the tent embassy to protest.
Nice.
So, but I guess I was a board member from 1993 to 1997, and in October 1997 I come to Winunnga. I took 6 months leave without pay from the ALO position at the old Woden Valley Hospital and come to Winunnga, and 19 years later I'm still here.
Can't get rid of you.
So back in the day I had 5 staff, and now I have 68 staff. And back then our budget was 241,000, and now it's 8.5 million.
Definitely grown the business, haven't you?
And I was just thinking about it the other day, like when we had our AGM last week, and I said, oh, you know, we've only ever had 3 chairpersons of Winunnga in 28 years.
That stability must be important.
Absolutely. And then I realised there's only ever been 3 CEOs too.
Wow.
So it was Olive.
Yep.
Olive's sister, Kay Mundine, the late Kay Mundine.
Yeah.
And then me.
And then you.
So...
Wow, that's amazing, particularly because that rarely happens in any organisation or sector. And there's a lot of turnover in the Aboriginal community-controlled sector, so it's fantastic to have that stability. So what made you decide to get involved in the Canadian and Australian Indigenous Health and Wellbeing Roundtable?
Well, as I mentioned this morning, the High Commission donated mattresses to Winunnga a few months ago.
Yeah.
So Paul Madison and the High Commissioner and his team come over to Winunnga, and we had a mattress here in the boardroom, and we did some media.
Okay.
We're on 666.
Oh, fantastic.
So talking about it and stuff, and you know, people think that mattresses, why would people in Canberra want to make a big deal out of somebody donating, you know, a few mattresses?
Yeah.
Well, you know, it is a big deal when you've got little kids that are sleeping on mattresses where the springs are poking out, and you know, families that are sleeping on the floor because they don't have a bed, let alone a mattress. So, you know, these things do happen in Canberra.
Yeah. I actually, when I first came to Canberra, I was reading up on Canberra, and I was quite surprised at the disparity between the haves and the haves not, and that there's a significant homeless population and a significant population that are below the poverty line, which you don't hear about. And obviously that's why Winunnga is so important, because a large amount of our mob are living in the area.
Absolutely, and a large amount of our people are actually the ones that are living in poverty, and you know, that really struggle every day. And I hate to think that what would happen to them if we weren't here.
Yeah.
And I guess for us and for a lot of our families, we are their family.
Yeah.
And you know, we're the glue that holds it together for them.
Yeah.
And it is about you know, supporting those people that have got nothing.
Yeah.
But also there's the working poor, and there's a lot of other vulnerable Aboriginal people as well. The elderly, isolation's a big issue in this community. And
it's going to become more and more of an issue as we start to live longer as well, and it's not really factored into policy, is it?
No, it's not. And the other consideration is that, you know, family breakdown and things, you know, and the way that the system works, and, you know, if somebody's been incarcerated and you've got a number of family members that have been in the prison, and then when they might be coming out one after the other, and, you know, you can't have 2 family members staying in the same house because that's called consorting and all of that.
Yeah.
So, you know, so for us as Aboriginal people, it really complicates our lifestyles and our families.
Yeah.
You know, being able to support wherever they can.
Yeah.
But, you know, I really believe that, you know, with the number of kids in out-of-home care and, you know, 25% of the Aboriginal population or 28% of the prison population here in the ACT are Aboriginal young men or women. And so, you know, when we make up 1.2% of the total population, it's pretty scary, really. And yeah, we want to keep kids in families.
Yes, that's the ideal.
Because bad things happen in foster care, you know. So all you're doing is re-traumatising the kids when you take them. They're used to being with their mother and dad, you know, like, and who are other people to judge whether they're good parents or not just because they might do things differently?
Yeah, and that's something that you hear a lot, isn't it? That when you remove the child, you're removing them from culture, you're removing them from love, you're removing them from their communities and their families, and that does so much harm to them. And does that negate the harm of someone who might not have a bed? Do you know what I mean? Like, you can give someone a bed, but you can't give them their family back.
Absolutely, and that's totally, you know, that's a great way of putting it, because that's so true, you know. And then, you know, we have a lot of mental illness, you know, the intergenerational trauma, all of those things, and so a lot of people with identity issues, not knowing where they belong, where they come from. You know, we've got big maps that were done between AATSIS, Winunnga and the ANU when Ray Lovett was doing, I think he was doing his masters at the time.
Okay.
And we've actually got them on our walls in all our doctors' rooms, and so that when young people come in or anyone comes in, they can show where they come from, and
oh, that's lovely.
You know, and we can find if they are having identity issues, then we can track.
No. That's lovely, because I mean, you know, you'd think the country would have learnt with Stolen Generation about the impact of trauma in communities and families that policy had, and with its increasing rate of child removals, that's only going to continue to perpetrate that trauma.
Absolutely.
So, well, we could talk all day, I think. But if there's anything you'd like to, you know, add before we sign out, because I know you've got other business you need to go to.
And, you know, just that we are forging a great relationship with the Canadian High Commission here. And I think that that's really, really important.
Yeah.
And it was really great to be invited to participate in the Roundtable, but also for clients and the women's group to be able to work on making the faceless dolls this afternoon.
Yes, that's where I'm headed straight. As soon as I finish the next interview, that's where I'm headed out, because I think that looks like a great experience. So thanks very much.
Thanks,
for that.
Summer. Thank you.